Good morning. Thank you all for joining us on today's call. This is Christine Norbert-Beyer, the Commissioner for the Department of Children and Families, and I'd like to thank our host, the Department of Health, and Commissioner Persicelli for having us here today. At DCF, we recognize that there's a heightened state of concern right now as licensed child care programs seek guidance from state and local public health officials in order to determine the appropriate steps to prevent the spread of COVID-19. Certainly, information is coming out about this disease seemingly every minute, and it can be difficult to keep up with the latest guidance to make informed decisions about the safety of the families that you serve. On behalf of state officials, I'd like to take the opportunity to thank you all for all that you're doing during this crisis to assist families and to respond to a shifting landscape of new information. In order to assist you in that effort, we've made some resources available on our respective departmental websites. The New Jersey Department of Education has released guidance for K-12 schools and child care centers to follow. If you haven't already seen that information, you can link to it from DOE's website as well as the Department of Health's website on the coronavirus or on the DCF website. At this time, DCF, through our Office of Licensing, it is advising child care programs to remain in contact with their local health officials in order to make the best decision possible regarding dismissal or closure using up-to-date local health information. We understand that there may be pressure on programs to remain open, particularly as school districts close and parents need to report to work. But at the end of the day, public health and stopping the spread of the disease has to be the priority. Program administrators should determine in consultation with their local health officials whether the child care facility can remain safely open. I know that some of the questions we've already fielded through DCF revolve around the impact of school closure and whether it's appropriate for a child care program to remain open when the school district is closed. I will say that the dismissal or closure of a school should not necessitate the closure of a daycare facility, but if the district and the child care center are operating from the same information, it may become necessary. We know that program dismissal and closure is an important non-pharmaceutical intervention to stop the spread of the disease, but program administrators should weigh the risk to public health against the day-to-day service they provide to families within their community. There really is no one-size-fits-all rule. At the end of the day, we're looking for program administrators to use their best judgment with the information available to them. Of course, please encourage proper hand washing and sanitation. Please stay informed. If you have questions for DCF, you can email them to askdcf@dcf.nj.gov. If your program does have to close temporarily due to concerns about the spread of the coronavirus, please be open and transparent with parents without adding to the anxiety that many of our parents are feeling throughout New Jersey. And lastly, please look out for the signs of stress and anxiety in the children you serve. This situation may increase stress for all of us in the helping professions. I understand that you, your family, and your network of friends may feel anxious, worried, or uncertain given how rapidly the situation is evolving. And our own vigilance and the vigilance of our communities can serve to heighten these feelings. One of the best things we can do is access accurate scientific information about COVID-19. We identified some resources to share with you, which may be useful as you navigate conversations with your own family or those you serve. Whether it's guidance from the CDC, the National Association of School Psychologists, or the American Academy of Pediatrics, there are resources to assist you in having the conversation and allaying fears. We're currently reviewing and will share these resources in the coming days on the DCF's coronavirus website. Thank you for your ongoing efforts for New Jersey's families, and stay safe. Thank you.
Good morning. This is Judy Persicelli, the Commissioner of Health. Thank you to Commissioner Norbert-Beyer for hosting this call. The Department of Health, along with Governor Murphy's Coronavirus Task Force, continues to prepare for and respond to the novel coronavirus. As of yesterday, New Jersey had 29 presumptive positive cases in our state, which sadly includes, as of yesterday, 1 death. Based on the trends we are seeing, we expect to see more cases in our state and we expect, unfortunately, to have more mortalities. Earlier this week, Governor Murphy declared a state of emergency and a public health emergency to ramp up New Jersey's efforts to contain the spread of COVID-19. Yesterday, he recommended that mass gatherings of 250 individuals or more should be canceled. Some local school boards have also been closing their schools. These types of steps are being taken to reduce the spread in our communities. Each community is unique, and appropriate mitigation strategies will vary based on the level of community transmission, characteristics of the community and their populations, and their capacity to implement strategies. We are working to keep the public informed as things are moving quickly. We've held conference calls and meetings for hospitals, local health leaders, schools, businesses, elected officials to keep them informed. Last week, we spoke to school leaders and encouraged them to prepare for cases of novel coronavirus. We recommended that daycare facilities take similar steps to prepare, including reviewing and updating and developing your outbreak response pandemic plan, and share with stakeholders before an actual outbreak occurs. Establish procedures to ensure students and staff who become sick are sent home as soon as possible. Prepare for potential of closures or dismissals or cancellation of events. Establish relationships with local public health officials and identify points of contact. Create emergency communication plans and maintain up-to-date contact information for everyone in your communication chain. Establish your leadership team. Identify essential staff functions. Assign tasks and responsibilities. Plan trainings to educate staff on prevention measures and continue to monitor current information from your health officials. There are, as you know, everyday precautions you can take to protect yourself and others. Wash your hands frequently for at least 20 seconds. Use an alcohol-based hand sanitizer if you do not have soap and water, but it must be of at least 60% alcohol. Cover coughs and sneezes. Stay home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, your nose, your mouth. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipes. Please visit nj.gov/health for information on COVID-19. We have posted this on our website, and it's information for schools, daycare facilities, as well as frequently asked questions. Administrators for schools, businesses, and other public places who want additional guidance on how to manage the risks posed by COVID-19 are invited to contact the Department of Health via email at ncov@doh.nj.gov. Thank you very much, and now we'll go to questions.
Thank you, Commissioners. At this time, we ask you that you please go to the chat box to send in any questions, and we will do our best to get to as many of these questions as possible. The first question that came in is, will there be any state assistance for child care centers who need to close?
So the Department of Children and Families, in putting together our continuity of operations plan, is putting in some monetary assistance for our contract providers. What that will look like yet and how that will be distributed if and when it becomes necessary, we will have to then communicate that more directly with providers, but that is something that we are considering and are making the request.
Thank you, Commissioner. The next question is, can my child care center stay open if the school district closes?
The simple answer to that is yes.
This is the Commissioner of Health. I would suggest you keep in close contact with your local health official, and if there is any information that would require you to rethink whether to keep your care center open, your local health official will have that.
What type of cleansers and what type of frequency do you recommend for cleaning public meeting spaces such as our community rooms or libraries?
Our understanding is that the household disinfectants that you use every day are appropriate for all types of cleanings in public areas. Additionally, if you go on our website, you will have a full guidance on disinfecting public areas. We're asking most organizations to just amplify or step up the cleaning that they're doing.
In addition, so good morning, my name is Chris Neuwirth, Assistant Commissioner, New Jersey Department of Health. So in addition, the EPA, if you simply Google EPA COVID-19, they have published on their website a list of disinfectant products by make and model that folks can reference when you attempt to purchase, whatever products you may need, recognizing that currently there is an interest in buying these products from everywhere. This gives you a menu of options that you can choose from, and we would recommend you simply follow the directions for whichever product you choose to ensure that it disinfects appropriately and inactivates the virus should it be present.
If our public schools close, are we allowed to take the school-age children into our centers?
You're saying within their license capacity? Yeah, so you can within your license capacity.
If we are required to close, are we required to pay our staff, or will they be eligible for unemployment?
We recommend that each employer group identifies their policies and procedures in regard to this. We know that if you are a state employee, the civil service has put out guidance on this, and we are suggesting that you try to be as flexible as possible. No one wants to stay out of work because of a COVID-19 exposure or because of some other issues that are affecting their families. So please, as employers, pay attention to the current workforce policies that you have in place.
Will the Department of Children and Families modify ratios and group size requirements?
Yes, so the department is actually finalizing guidance as we speak that will be sent out to all of our licensed child care centers, giving some direction about some of the rules that we will be modifying during this time. And so once we receive all the necessary approvals, we'll be sending that out to all of you.
Our program accepts subsidies in case our parents must swipe a card to ensure getting paid. If parents are to be discouraged from entering the facility, how do we ensure payment?
I'm not sure I fully understand the question. Is it, so I think with regard to subsidies, and it sounds like the question is, if you can't access the building, because you can't use a swipe card, that we're going to have to reach out, and I'll direct my assistant commissioner over childcare licensing to reach out to the directors of the centers or to issue some guidance around ensuring that individuals are not able to, not get their subsidy or use their subsidy, as we are going through this.
I think there's a follow-up or
Okay.
maybe a clearer for this question, Commissioner. Are we working with DHS to increase part-time subsidies for families in Abbott programs to full-time subsidies during this emergency situation?
So we're,
Do you want to answer? Just introduce yourself.
hi there. This is Brian Ross, the Assistant Commissioner at DCF over Child Care Licensing. We would have to largely defer that question to the Division of Family Development. They are working very closely with their federal partners to make accommodations to try and be as responsive to the needs of centers as possible. At this point, they have no firm guidance to give, but I know they are in constant communication with the federal government on what they might be able to do in those cases. So more info will likely be coming shortly.
If we close our preschool, should it be just for 14 days or longer? And who would we refer to for this information?
This is Judy, the Health Commissioner. Right now, the recommendations for school closings will probably include a 14-day period. That corresponds with a 14-day period of incubation of most of the coronaviruses. Now, the reason I say most, as you know, this is a novel coronavirus. We believe it is showing characteristics similar to other coronaviruses. I will share with you that there are many, many coronaviruses. One of them actually causes the common cold. So we are going along with the 14-day, but as I have shared repeatedly in daily press conferences, this is an evolving situation. And I like to say it's evolving day by day, but I'm coming to the conclusion it's evolving hour by hour. So things will change. We just encourage you to access our website, DCF's website, and the guidance that we can give you will be our most up-to-date information. Additionally, if you have any questions, please contact your local health officer. Thank you.
And we got a question regarding access to this link, so that if folks need to listen back to the audio once we conclude, will they be able to? The answer to that question is yes. The link should remain archived, so if you click on it, you'll be able to listen to this webinar from the beginning. There's a question about clarification regarding county versus municipal level local health departments.
Say that again, I'm sorry.
If they should be working with their county or their municipal local health department.
You should be working with your local health official.
Will the state continue to pay for those children who are on a subsidy if the center closes?
So again, we would have to defer to the Division of Family Development, and they are working on guidance for that. There has been some discussion nationally about expanding the number of closure days that are authorized, but there's been no firm guidance on that yet. We would expect more information to be coming shortly.
In the likelihood that there is a mandated closure, how do you recommend we communicate to our families?
If there's a mandated closure of all daycare centers, the communications experts here at the Department of Health will put out an alert and help you with that communication.
And we have a few questions about collaboration with the Department of Labor and Workforce Development and the Department of Human Services. So we will be sharing some of the questions that are coming into the chat box that we need their responses for and their input on with our teams from these agencies. So please be assured that if your question did not come up, it is not necessarily because we're ignoring it, but we need input from our colleagues in the other agencies to prepare, and this will help guide us as we develop FAQs and update the guidance that we have available on our websites. More questions about attendance. Should we be concerned about carpools, and what can we do to report attendance for any of our subsidized parents?
Carpools? Should they be concerned?
Oh, should you be concerned
carpools?
about carpooling? At this point, if there is not an exposure, I don't think you need to be concerned, although we are recommending people be very cognizant of social distancing techniques, space between individuals, primarily individuals that are coughing and sneezing, stay home. Individuals that, particularly children, that you can't control some of their hygienic practices, just be vigilant and keep children as far away from one another as you can, as your capacity allows.
There are some follow-up questions regarding clarity for the unemployment benefits. Again, we will be working with our partners at the Department of Labor and Workforce Development to get clarity on those. There's another question regarding updating the guidance on our websites. Once again, we have clarity from some of these questions, we can include them in our FAQs on both the DOH and the DCF website, and you'll have the updates to these answers in a timely manner. So it looks like we've gotten through the majority of the lumped questions that we can answer with the individuals that we have in the room. So what we're going to do is we'll stay on, some of us will stay on a little longer so that the chat box remains open, and allow for you all to continue putting questions in. And any question that we were not able to respond to here live during the webinar, we will make sure that it gets to the correct individuals and that we're able to put responses to these questions in our guidance and FAQ documents. Commissioners, do either of you have any closing remarks?
This is Judy Persichilli, Commissioner of Health. I just want to thank you for joining us. I want to emphasize again, this is an evolving situation. Please access the websites that we've given to you to get the most up-to-date information that we have, and we will stay in close contact with you. Thank you. Commissioner?
Yeah, I just want to echo Commissioner Persichilli's thank you for joining us today and participating in the Q&A. We will have information up on our webpage as soon as possible, and as we've talked today, guidance is changing frequently, information is coming out rapidly, and so we're working to try and update that as quickly as possible. Again, for DCF, if you have specific questions for us, you can send them to askdcf@dcf.nj.gov. Thank you.